Stephanie, thanks for joining us.
Thanks, Jerry. Thanks for having me.
The decision was a big one and clearly a big victory for the president. His signature domestic initiative upheld by the court, but it comes with some political complications. In particular, the court said that the individual mandate is in fact just a tax on those people who don't have health insurance. And Republicans, starting with Mitt Romney, have jumped right in and said,
Obamacare raises taxes on the American people by approximately $500 billion. Obamacare cuts Medicare by approximately $500 billion. And even with those cuts and tax increases, Obamacare adds trillions to our deficits and to our national debt and pushes those obligations on to coming generations.
What's your response to that?
Well, I would say a couple of things. Effectively, there's no change in the law. What the law says is that most people have private insurance, as you know. Those that don't probably don't have it because they can't afford it. So the law provides the largest middle-class tax cut in history to help people afford health care. So for those who get a tax cut or can afford it and still choose not to get it, there is a penalty. And that is estimated at about 1% of the American people. Now, the same model was used in Massachusetts. In fact, Romney Care was the model for Obamacare, where a mandate was required. If you could afford it, you had to get insurance. If you didn't, you paid a tax penalty. So at the end of the day, there's no change in the practical effect of the law. And lots of things, we're going to continue moving forward on. Prescription drugs for senior citizens, ensuring that kids with a pre-existing condition can get the care they need, or preventive care, whether it's mammograms or blood pressure checks, people can now get with no out-of-pocket costs. So there's no practical effect of the decision. We're going to continue to implement it, and the people who are already benefiting of it are in danger of losing it.
You know, Stephanie, one of the interesting things President Obama said in his reaction to this was that maybe there are ways to improve the Affordable Health Care Act.
The highest court in the land has now spoken. We will continue to implement this law, and we'll work together to improve on it where we can.
Do you know what he was referring to and what kind of improvements he might have in mind?
Yes. In fact, last year, he actually supported a way to improve the law. Right now, in 2017, the law is fully implemented. If states have a better way to reach the same benefits and cost savings and coverage, then they can opt out of the Affordable Care Act and innovate and put their own plans in place. The President supports moving that date up to 2014. So as we continue to implement the law in 2014, when it's fully in effect, if they discover they have better ways of doing this in ways that suit the needs of their states, then the federal government is open to it. So the President is in favor of moving up that date to allow states to opt out. That's called the Wyden-Brown bill in the United States Senate. The President came out for that over a year ago. That's a significant way to improve the law and promote innovation at the state level.
Let's talk a little bit more about the politics of this. You know, one of the things Republicans are clearly trying to do is use this decision to mobilize their base by essentially saying only Republicans in Washington can drive a stake through the heart of Obamacare. That's probably a pretty effective mobilization line for them, isn't it?
Well, Jerry, I'm not an expert on the Republican Party, but I do know that that's what they've been running on for the past 2.5 years now. And I'm not sure that's enough. Most Americans, an overwhelming majority of Americans, don't want the law repealed. Some of them want it to be improved upon. Some of them don't think it goes far enough. So if that mobilizes the far right wing of the Republican Party, then that's fine. But for the overwhelming majority of the American people, they want the law intact. We can improve upon it when needed, but they want to move on. They want Washington to turn their attention to the economy, and that's what the president is urging Washington to do.
You know, the other thing Mitt Romney said for his part was that we can save the popular parts of this bill even if we kill the rest of it. We can save health insurance for younger people. We can save health insurance for people with pre-existing conditions. What's your reaction when you hear those kinds of things?
Well, I think he's not telling the truth about his position on saving protections for people with pre-existing conditions. What his position is actually been the law since 1996, that if you have coverage now and you change jobs, or you lose your job and go on COBRA, then you can't lose your coverage because of a pre-existing condition. But what that doesn't mean is that if you have a new pre-existing condition, or if you lose your job and don't have the ability to go on COBRA, you have no protections at all. So what he is saying when he says that he wants to cover people with pre-existing conditions, he just wants to go back to the old 1996 law that really did nothing to ensure that people who were sick couldn't afford coverage because they were priced out of it, or were denied because of insurance companies' abuses, that those people remain without coverage under Mitt Romney. So he's just not telling the truth about what his position is. And, you know, back to your original question about saving the popular pieces of the law, we're all for that. We want to continue implementing the law. There are millions of Americans already benefiting from this law right now with better quality care and better security in knowing that their health care will be there when they need it. We're happy that he wants to support the popular things, but you know, this is typical Mitt Romney. He's not willing to make the tough decisions and to get true health reform done. As the president said today, he didn't do this because it was politically popular. He did it because it was the right thing to do.
Stephanie, let's just cast forward finally, just briefly. We're all obsessing with health care right now. As you note, it's not necessarily politically popular. How much is the president really going to want to talk about this over the next 4 or 5 months?
Well, he talks about it all the time, Jerry, on the campaign trail. It's a significant accomplishment of the last 3 years since he's been president. It's a significant accomplishment because, as I said before, there are tens of millions of Americans already benefiting from the law. So he talks about it all the time, and we talk about it all the time. We're proud of the fact that after 70 years of trying, this president finally got health care reform done. And we welcome a conversation with Mitt Romney on health care, our opponent. Again, you know, he was the author of Romneycare in Massachusetts. Romneycare was the model for national health care reform. Mitt Romney called the individual mandate essential in enacting health care reform, and we agree with him. So we are open to this debate with him, welcoming the debate of him, and we look forward to what his ideas are for health care reform, since he wants to repeal the president's health care reform. In his words, he wants to kill it dead on day one. So what does that mean for the tens of millions of people that are already benefiting from it? We thought his statement today was completely callous and disregarding what he would do with the people who are already benefiting, saving money, ensuring their kids can get care, senior citizens getting preventive care without no out-of-pocket costs. What about all of those people? Mitt Romney just cast them aside in the name of politics because he's seeking the presidency. He completely changed his tune from his own health reform law in Massachusetts.
Well, Stephanie, it sounds like we're going to get to have that conversation over the coming weeks, and I'm glad we got to start it today.
So.
Thanks for joining us. Hope we can do it again.